Gentlemen, if you think you understand women, I promise you, today's science is about to surprise you. Because what actually happens inside a woman's mind and body during intimacy is far more complex, far more fascinating, and far more impactful than most men ever realize. Hey there, gentlemen. Dr. Lina here, your urologist, men's health advisor, and the one doctor who's going to tell you what most people are too uncomfortable to talk about. Today, we're diving into a topic that's whispered about, joked about, avoided, or completely misunderstood, yet it shapes relationships, trust, attraction, long-term happiness, and even health. Before we go deeper, do something simple for yourself. Hit that subscribe button, because if you care about science-based insights into psychology, health, and intimacy, you're exactly in the right place. And trust me, what you learn today will change the way you understand women forever. So why are we talking about this? Because men deserve the truth, not myths, not locker room theories, not social media nonsense. Real science, real biology, real psychology. And once you understand what's actually happening inside a woman's brain and body, you'll realize intimacy isn't just physical. It's chemical, emotional, neurological, and it influences everything from bonding to sleep to mood to long-term connection. Let's break it down the same way I explain it to patients in my clinic. Simple, clear, and grounded in research. Fact 1. It's not just physical, it's chemical. Most men assume intimacy is just about pleasure or physical closeness. But here's the truth. During certain intimate interactions, there's a biochemical exchange happening. Women can absorb trace amounts of hormones like oxytocin, the bonding chemical, serotonin, the mood stabilizer, melatonin, the sleep regulator. Biologically, these chemicals influence emotional bonding, trust, stress levels, and even sleep quality. Emotionally, this explains why a woman often feels more connected, calmer, or more affectionate afterward. Practically, this means something powerful. Her emotional experience isn't separate from her biological experience. They work together. And men who understand this automatically become better partners, better communicators, and more emotionally intelligent because you're responding to biology, not guessing. Fact 2. Oxytocin, the bonding hormone. Oxytocin is one of the most powerful chemicals in human biology. Women release large amounts of it during eye contact, gentle touch, hugging, deep conversation, and yes, intimacy. Biologically, oxytocin strengthens social bonds and builds trust. Emotionally, it makes women feel safe, open, affectionate, and relaxed. Practically, here's the takeaway. Connection before intimacy matters more for women than most men realize. When she feels understood, seen, and safe, her brain releases more oxytocin, and her entire emotional and physical experience becomes deeper. This is why attentive intimacy, listening, and presence aren't nice gestures. They're biological necessities. Fact 3. Serotonin and stress. Mood matters. Serotonin isn't just a feel-good chemical. It regulates anxiety, mood, emotional sensitivity, stress tolerance. Certain forms of closeness and intimacy can subtly influence serotonin levels. When a woman feels emotionally secure, her stress decreases. When her stress decreases, everything in the relationship improves. Communication, patience, affection, understanding. Emotionally secure women don't just feel better, their biology shifts. And practically speaking, small, consistent gestures matter more than big, dramatic ones. Daily emotional warmth has long-term biochemical effects. Fact 4. Melatonin, sleep, recovery, and emotional stability. Here's something most men don't know. Certain intimate experiences can cause small increases in melatonin, the hormone that regulates sleep. Biologically, melatonin helps improve sleep quality, regulate the internal clock, promote deeper rest. Emotionally, better sleep equals better mood, less irritability, more patience, more affection. Practically, healthy intimacy can become part of a nightly routine that improves both partners' sleep and emotional stability. Fact 5. Immune system priming, long-term bonding. Now here's a fascinating one, and one of the least known facts. In long-term relationships, repeated exposure to a partner's biological fluids can help the immune system recognize and adapt to foreign proteins. This is part of what's known as immunological tolerance. Biologically, this may support reproductive health and long-term compatibility. Emotionally, long-term trust deepens a woman's sense of safety and belonging. Practically, consistency and stability aren't just emotional virtues, they're biological advantages. Fact 6. Risks are real. Honest conversations matter. Let's get real for a moment. Intimacy has benefits, yes, but it also comes with risks that men often underestimate. Sexually transmitted infections, bacterial exposure, allergic reactions, hormone-disrupting substances from poor lifestyle habits. Biologically, these risks can affect a woman's reproductive health, immune function, and long-term wellness. Emotionally, when a woman doesn't feel safe, connection collapses. Practically, talk openly about sexual health, practice safe intimacy, encourage regular screenings, take responsibility for your lifestyle choices. Protection is part of partnership. Fact 7. Lifestyle matters more than men think. Your habits affect her body. Whatever's in your bloodstream, alcohol, nicotine, medications, hydration, toxins, alters the biochemical composition of your fluids. That means what you eat, what you drink, how you sleep, whether you smoke, how active you are, all impact her health during intimacy. Emotionally, when men take care of their health, women feel safer and more attractive. Practically, being healthy isn't just good for you, it protects her. Action plan, especially for men over 40 to 60. Communicate openly. Talk about boundaries, health, comfort, and expectations. Transparency builds trust. Prioritize your health. Eat clean, hydrate, reduce alcohol, exercise, manage stress. Be emotionally present. Connection is not a side feature, it's the foundation. Create relaxing nightly routines. Sleep, intimacy, and recovery go hand in hand. Get screened regularly. STI tests, prostate checks, hormone panels, cardiovascular health. Support her wellness. Healthy partners create healthy relationships. Remember, intimacy is not something you perform. It's something you build with emotional safety, curiosity, and consistency. Gentlemen, take a breath. Let this sink in. Age does not limit your capacity for connection. Knowledge does not replace passion. It enhances it. And emotional presence, trust, and communication are biological catalysts for deeper intimacy. You're not behind. You're not broken. You're simply learning how powerful biology truly is. Approach intimacy with respect, curiosity, and confidence, and you'll strengthen not just your relationships, but your sense of self. If you found today's video helpful, take a moment to like it, share your thoughts in the comments, and subscribe for more medically accurate, psychology-based insights from a urologist. Turn on notifications so you never miss a new explanation of the science behind connection, behavior, and health. Take care of your body, your mind, and your relationships. You deserve the best version of life. Thank you for watching.